Welcome to Third Floor Views, a production of Chesapeake Family Life, where we talk about health, education, and living with kids. I'm your host, Janet Jefferson. This episode is sponsored by Annapolis Pediatrics, and for more than 70 years, Annapolis Pediatrics has provided exceptional health care to infants, children, adolescents, and young adults in Annapolis and the surrounding communities. They have over 30 physicians and nurse practitioners to serve your family, and now in 6 locations: Annapolis, Crofton, Edgewater, Severna Park, Kent Island, and Pasadena. Learn more about Annapolis Pediatrics and find helpful parenting resources, videos, and more at AnnapolisPediatrics.com. Today, we're talking about child and parent anxiety. And joining us is Dr. Shandonna Harris, a therapist specializing in client-centered therapy, and Michelle Schall, a certified pediatric nurse practitioner from Annapolis Pediatrics. Thank you so much to both of you for joining me today.
Sure.
Thank you for having us.
To our viewers, if you have any questions or comments, feel free to put those in the chat section and we'll get to those as we can. Let's get started. So first, I'd like to ask both of you what you've been seeing in your patients lately. Have you been seeing an increase in anxiety in your patients? Or is it fairly stable? Is it high? Is it low? Dr. Harris, I'll start with you.
Yes. Yes, I've definitely seen an increase in anxiety, especially with recent events that have been happening. A lot of my patients do come in and talk about like just feelings of worry, overall concern, feelings of being safe and making sure that they are safe in the places that they're going to. And then as far as kids are concerned, the parents that I see, I know they worry about like end of school stuff, right? So what are you going to do with your kids in the summer? So there's some anxiety around that, trying to find things to keep them enriched and keep them busy, and with adjusting to now a changing schedule for everyone, for parents and kids involved. So that's mainly what I've been seeing.
Yeah, transitions are always hard for anyone, but especially for kids.
Yeah.
Nurse Schall, what are you seeing with your patients? Are you seeing an increase in anxiety?
Absolutely, for sure. I feel like the past several years, the pandemic, we went through that, of course, to set the stage off a little bit more, and then recent events that unfold too. I know that we're going to talk a little bit more about, but absolutely seeing more of a lot of emotions all over. But the talk today about anxiety, absolutely. I feel like I even see them too from a primary care standpoint. They come in for stomach aches is the chief complaint. It's abdominal pain, it's headaches, or fatigue. A lot of times are the big complaints that come about, and parents come in thinking they're going to get physical diagnoses when really I'm like, it's anxiety. These are emotions that do real things to our bodies overall. So seeing a lot of what Dr. Harris is seeing, and then on top of that, the physical things on my end, seeing those come in. I know I was going to say a recent study that I had seen from the Health Resources and Services Administration, not sure if you've seen that. They looked at kids prior to the pandemic, so in a couple years before then, right through like 2020. So right after the pandemic really started and hit at that point in time. So I'm sure the rates are probably higher, but in kids ages 3 to 17, the rates of anxiety diagnosis actually went up about 30%. So that's big. That's big in a few years.
Yeah, that is a lot. Nurse Schall, how are you differentiating between what is anxiety or what is actually a stomach bug, or what is maybe fatigue due to some other reason? So how are you diagnosing anxiety? And do you have any suggestions for parents to know the difference between what is actually a physical ailment due to a virus or germs versus something that is maybe more going on in the child's mind?
Sure. That can be very difficult, even difficult for us at times. Absolutely. There's not a lot of slam dunks that come in where we say hands down, this is that, where sometimes it is weeding things out. It's extensive history taking from parents and from kids, seeing when their symptoms started, any things that are around, how long has it been going on? When does that stomach ache come on? Does it come on every morning before we get out the door for school, but it's not there on Saturdays and Sundays? Or is it around certain situations or other things that may come about? So sometimes like tying in the timing of the aches, the pains, the occurrences, the sleep troubles, other things too? Does that kind of play into their routines at all, or whenever they're proposed against these stressors, is that a piece of it? But oftentimes it is not. It is not. It is. We want to see you whenever there is impact made in your child's day. So if they are not sleeping well, they're not eating well, their function overall is not doing well, which could be both from physical diagnoses or also from anxiety and other emotions too. So that's a little bit of a tricky question. So sometimes it does take a lot of time in the
Yeah.
office, kind of working through a lot to go through and to see exactly what's going on, or is it both? Sometimes it is multiple things.
Yeah. Yeah.
But yeah, I was going to say too, I'm glad you brought up the physical and the somatic complaints, because that is something that you can see as signs of anxiety, stomach aches, headaches, muscle tension, body aches and things like that. And from my perspective, it is a lot of like you said, history taking and trying to get an idea of when these symptoms started. Were there any triggers that had what was going on around that time when the symptoms started? Was it situational? And then there's also psychological assessments that we use that can determine different levels of anxiety, whether it's something that is mild or moderate or more severe, requiring like a more severe, more intense interventions. So that's the way that we can tease out whether it is, a physical or a medical condition versus actual anxiety that they're suffering from.
That's helpful. Dr.
hmm
Harris, so we talked a little bit already about the parent side of this, but I want to know more. So at this point, parents have
hmm
been like, how far are we into COVID? Over 2
hmm
years. And then we have had our own national challenges, whether it be sort of the summer of 2020 with a racial reckoning. We also
Yeah.
had, a huge election. And then
hmm
now more recently, we've dealt with a war in Europe, which we haven't seen in a long time. And
hmm
then of course, we're seeing now more mass shootings in the headlines. There's so many things to be worried about. How
Yeah.
are parents doing? How are your clients who are parents, like, how are they pulling
hmm
it together? Is everybody pulling their hair out? Or like, is this a collective, we're all
mm
hanging on together? Or are you seeing some people hit harder than others? What is sort of
mm.
the temperature of parents these days?
I would say the reactions do vary. Some people it is a lot harder for them to deal with, and sometimes that turns into more of a hypervigilance or like a paranoia. So
Mm,
for example, with the situation that happened at the grocery store in Buffalo, I've had clients be afraid to go to grocery stores or feel anxiety when they can't find where the exits are when they're somewhere, things like that. And for that, we just try to manage the feelings and differentiate between rational thoughts and things that they may have catastrophic thoughts or maybe blowing things out of proportion and trying to figure out what are the triggers for those anxieties. And then there's other people who are able to manage it with support, whether that be therapy, whether that be their friends that are also going through similar situations. There's also support groups for dealing with anxiety. And then there's also medication that helps when you really feel like your anxiety is out of control and it is messing with your daily functioning, whether it be concentration, being able to go to work, um, activities of daily living as far as like hygiene, eating, sleeping, things like that. So it is a mix of responses, and that makes sense because everybody responds to things differently, especially when events are traumatic and
mhm.
can leave an impact on you. And these things we can't really escape because we're on social media, it's in the news, we speak to our friends, so we can't shelter ourselves from it. But there's also recognizing, when you're reading too much information, you already have this information, now you're kind of oversaturating yourself with it. And it's just, when you read it, it's just more anxiety. So being
Mhm.
able to know when to take a break from it, um, to be able to relax and not be as tense about the situation.
Right, right.
Mhm.
Nurse Schall, are you also seeing parents asking for more resources in terms of their own parental anxiety, or are parents still super focused on their kids when they're coming to talk to you?
No, absolutely. I think, and we think about anxiety in general, whether we talk about the child or the parent. I mean, it's the family is absolutely involved. Everybody is affected by it,
Mhm,
and everybody is involved in helping, I guess, or working towards that treatment.
mhm,
Definitely a lot of parental anxiety that we can either we get to know the families, which is nice on a primary care level when they come in, and so we know if like something's wrong, something's not going so right, or that something's different going on in their household, where we can feel comfort in talking with them about that. And a lot of times I can bring that up, and I feel good about doing that because I get to know the families, which I enjoy.
mhm, mhm,
Sometimes they do bring it up to us, absolutely. So they're like, I've been trying to call and get in, I can't find anybody, or I've just given up. And I'm like, don't give up, don't give up. Here's some resources that we may have, overall. So sometimes we do absolutely hand that out to them. And then from a pediatric standpoint, children feed off of other people and emotions that are around them. So sometimes a child's anxiety can often be trickled down from those around them if they're feeling that uncertainty. So acknowledging that too, which you bring out and we discuss.
Yeah, yeah, absolutely. What do you recommend, or how do you recommend adults talk to children about some of these recent events, whether it be war or mass shootings or these other big stressors that are scary topics for everyone? How should parents or even educators start to approach some of these topics when they're talking to children? And Nurse Shaw, I'll start with you.
Sure. I think even beforehand, I just want to say a couple things that sometimes we feel that talking about these scary things with them is going to be cumbersome. It's going to be a problem when actually not talking about scary things and letting kids feel it actually makes them more scary. So they make it just exacerbate things. So talking about them is absolutely a good thing. I think parents should, whenever these events do come up, they should learn about this first, process things first themselves, and kind of get your script ready in a way, or kind of think about your responses to your children before engaging in that. That may be helpful, and you may feel a little bit more prepared and kind of answering their questions overall. And then, as Dr. Harris has said about the media, so especially with kids, the news is not the way to start the conversation with them. Kids really don't need to see the news. Perhaps older kids, they can learn from that a little bit more, but the way that the news media is presented is typically not in a manner that's for children. So
Hmm.
that's not the way to do it, but in talking with them, overall. I think a lot of it depends on their age and their development and kind of where they're at when you initiate that conversation or you're answering their questions. It's in a way that's going to meet them at their developmental level, overall. Younger kids, I feel, especially younger kids and early elementary school kids, they are rather egocentric in a way. And I think that's actually a good selfish trait that protects them from some of these things. So they're going to still live their lives and may not fully understand everything in a way, again, that I feel like protects them with some of these happenings overall. But when talking with the younger crowd, I feel they have such a great imagination that unfortunately, if we are too vague about our answers to some of their questions, it may just let their imagination kind of take off in a negative way. So answering questions in a way that are going to be accurate answers for them and not too open-ended. That way they can fully understand what's going on, without taking off with it. And then the
Mhm.
older they get, they're more concrete thinkers. So I'm sure Dr. Harris, you've seen this too, where we can approach things in a different way and give better reassurances of things that are tactile that they can actually validate. The doors are locked in the school, given that reassurance through things like that. Through there, you have teachers there with you. When you're outside on the playground, there is somebody that's out monitoring with you, keeping you safe.
mhm,
I'm the one taking you to school. The bus driver is fantastic. They're the one taking you to school, keeping you safe. Reviewing those concrete things that they can feel for safety, that they know are going to be there. Or
Mhm. Yeah.
drills. I'm not sure if all schools are running drills, and
right.
there's drills for lots of things, but some are getting into these kind of situations to help practice kind of what to do and to put those in place. And then the
Yeah.
older
Mhm,
they get, I think we can um, have the older folks understand that they are an active role in safety, and they're an active role in helping their peers, themselves, their school. And I think that helps when these situations do come up. It feels like they are more proactive, that they have a step or a role in helping overall.
mhm.
such as, not letting strangers in the school building, to keep the doors locked. If you see something, say something. So whether it be
Hmm.
threats or peers, other things that do come up. So I think a little bit of that can give them a little bit of reassurance that they have an active role in it.
Yeah,
Hmm.
that's really helpful. Those are helpful tips to remember to be sort of child-centered and developmentally appropriate. So with the young ones, keep it simple, keep it direct. Don't be too vague, but make sure you're fully answering their questions. And then with the older ones, reminding them that they are empowered to be part of the process, and a
Hmm.
reminder of who their safe people are and that they are surrounded by safe people on a regular basis.
Hmm.
Um, Dr. Harris, what do you tell your parents? How would you recommend that they talk to their children
Hmm.
about some of these events? Do you have any tips or tricks that you would steer them towards when talking to kids about
Yeah.
scary things?
Right. I agree totally with everything that Michelle said. And I think my biggest thing is for the parents to be aware of and manage their own anxiety before, during, and after speaking with their children, because you don't want to place anxiety onto your child. You can be aware and you can validate their feelings of worry or concern. You can express, that you felt the same way. You can tell them how you deal with feeling like that. Let them know the door is always open for them to talk to you about those feelings. And depending on their ages as well, if they know about like mental health services or counseling services at school, that those are available for them. Especially like the older kids, to know that they can ask for those services themselves. And I know they promote that in school as well. Like if you are feeling away and you want to talk to someone, there is someone here available to talk to you. So being able to let your kids know that there are people there to support them, there are people there that they can talk to about these feelings and concerns, and that we don't ignore them. We notice those signs in them, and we notice that something is going on and they're having thoughts about these things, and we ask them, how they're feeling and how they're doing.
Mhm, mhm.
Yeah.
I love your suggestion of with parents checking their anxiety before, during, and after the conversation, because
Yeah.
you're right. Like those feelings really do
Hmm.
change as you're in the moment with these conversations
Hmm.
with your kids. And parents are such a filter for kids' emotions, and kids are feeding off of what they are seeing in their
Exactly.
parents. So
Hmm.
trying to take care of ourselves first, which is so hard to do. It can be easy to say, but so hard to
Yeah,
do.
we talked about that before. We've definitely talked about that before, taking care of ourselves.
Oh my gosh. So with that, what advice do you have for parents to manage their own anxiety with these topics? What are you telling parents to do? Especially, there's so many parents that are, either friends of mine or acquaintances
Mhm.
that I'm seeing them, especially with these school shootings in particular. Um,
Mhm.
they're like, I put my kids on the bus, and then I'm afraid that could be the last time
Yeah.
I ever see them, which, we believe that school is a safe place, and we believe that school is a place to, learn and grow and play.
Mhm.
And the thought that safety could be broken, it
Mhm.
feels not only horrific, but very personally
Yeah.
violating. And as parents, we're so out of control because we're someplace else, we're physically someplace else, and we don't know what's going on.
Mhm.
So it's so easy for parents to feel so anxious about that, and I
Yeah.
think it could escalate pretty quickly. So what advice do you have to check parent anxiety
Mhm.
when they're talking to their kids, or even when they're just going through their day and reading the news? And Dr. Harris, I'll start
Right.
with you.
Right. And that's the thing about anxiety, right? It has a lot to do with thoughts and what we think. And those thoughts then spiral into the next thought, into the next thought. And depending on how you're thinking about things, it could be worst case scenarios, it could be catastrophic thinking, anything like that. So trying to bring yourself back to the present moment is what I tell a lot of my clients, whether that be doing grounding exercises. It's like looking for 5 things you can see, 4 things you can feel, or breathing exercises, relaxation training, as far as like being able to relax your muscles, being able to do some deep breathing. And I'm an advocate for walks. and being able to be mindful and present in the moment. Don't have your phone and don't be looking at any news articles for sure, but to just be out in nature and being able to walk and staying present in the moment, to be able to recognize those feelings of anxiety when they come. And if you have your own therapist, definitely speaking with them about how you're feeling. And then they can help you determine if therapy is the only thing that you need, or you may need medication to help manage that anxiety. And that is not a bad thing. I think there's some stigma, around taking medication for having a mental health disorder, which to me is interesting, because if you have a physical ailment and you take medication for it, it's everybody says it's okay, but it's the same thing. It's all health related, right? And so if this is something that's going to help you be productive and manage your day and manage the symptoms that you're experiencing, then why not take care of yourself, so that you're able to be there to take care of others. So I would say just basically like trying to stay present in the moment and be aware of the thoughts that are causing and triggering the anxiety.
Yeah. Yeah. I think that's also such a good reminder, Dr. Harris, on our cultural challenges around mental health, and that we've got to flip the script on that and really think about how we can see our bodies holistically, and it all needs to be cared for and healed appropriately.
Mhm.
Nurse Schall, I wanted to ask you about sort of things to look out for. What behaviors should parents and educators be on the look for when it comes to anxiety? Like when should we be really worried? Like when do we need to seek professional help? When do we need to maybe even get just some extra support or resources to help our kids through some of this stuff? What recommendations do you have?
Yeah, that's a great question, because sometimes we feel like we go through the motions of life and we don't know, when do we stop, when do we reach out. So
Mm.
I think that it depends on where we are. I think I always like to tell my patients, though, that anxiety and worrying and frustration and like emotions are normal. So it is normal for us to have emotions and to have times where we worry, or to have times where we may feel anxious. But I think the biggest thing, for parents to know, and for kids too, sometimes I have the teens who reach out to their parents saying, "Hey, like I'm not well, something's going on," is whenever their function is greatly impacted. And that for especially for pediatrics, we think of sleeping. So kids, they either cannot fall asleep, they just sit there, their mind goes, they worry, or they wake up in the middle of the night. So sleeping starts becoming an issue. Eating. So if they're not eating well, sometimes it's that anxiety gets that pit in your stomach, and just appetite goes down overall. Sometimes this may lead to weight loss. I see kids who come in for other issues, and I look at the vitals and I'm like, all right, let's talk about it. What's going on? We can see just the number going down and the weight overall. Um, if they have troubles with peer interactions, so they're trouble reaching out to friends or making friends, they're more withdrawn, they're more kind of pulled back, and their personality is changing. They're not as outgoing as they once were. Or if they are having troubles at school. So if school is becoming an issue with focusing, sometimes it's simple as just focusing is the biggest complaint that we get. And when we start diving down a little bit more, it's actually they're having anxiety, which has taken over their ability to focus, in school, grades, other things too. Sometimes it's
Mhm.
a social anxiety. I feel like even with COVID, separate from even the events that kind of have come up, so
Right.
man, the social anxieties, these poor guys, and I think it's for all ages, not just pediatrics, but all ages for sure. We were at home for a good period of time in a
Mhm.
comfort zone, and then we were plopped back into the world, and especially for kids, that was about a 2-year period of development that they weren't in the setting where we were able to nurture that and foster their development on a typical basis where we are. Obviously, at homes, everybody tried their best, and we've all done great. But that social interaction and pieces were such a piece of who they are. So sometimes it's the social anxiety that we can see, not wanting to go to school, pulling back from
Mhm.
practices, not seeing friends, staying home more. So if you're a parent or a guardian and you're seeing any of these things or multiple of these things, this is when you really want to reach out. Reach out to us in the primary care level, or as Dr. Harris said, if you have a therapist, then re-engage and talk about it.
Nurse Schall, is there a common age that you really start to see anxiety manifesting more than others? Because you had mentioned earlier that when they're really little, they're a little bit self-absorbed, but in a good way. It can be a self-preservation behavior. When do you really start to see some of these concerning anxious behaviors manifesting themselves?
It can really start at any age. Obviously, we do see the more anxious or reserved toddlers overall, but then moving up and we see more impact made, I'd say coming into school age years. So
Mhm.
elementary school, maybe late elementary school, we may see it a little bit more through teenage years for sure.
So it really can come at any time.
Sure. Yep.
Mhm.
Okay. Okay. Dr. Harris, what any other red flags that we should be looking
Mhm.
at in terms of mental health? You know, is there something that parents should be aware of either for their children or themselves that are like, you know what, I need help?
Yes. I definitely would say just noticing changes overall,
Hmm.
particularly changes in mood. So for children, a lot of times you may see a more like angry or irritable mood, and they may have, as Michelle said, issues with concentration. They may feel like they're more tense, or they may seem more fidgety. And then, like she said as well, like bathroom issues, eating issues, and sleep and things like that. And for adults, I think a big red flag is like noticing that again, you're changing mood. Maybe there are some things that you are avoiding engaging in because of the tenseness that it's bringing about, which, for adults, it's a lot of things because we go to work and so there's stress, but it is to the point of that it's in an impairment.
Hmm.
So that means like you can't engage in these activities or they have some sort of negative consequence when you engage in them. There's also, if you are not finding pleasure in activities that you once found pleasure in, like you still love to hang out with your friends, but now you feel more isolated, you don't have the energy to do that, then I would think that's a time to reach out for help. So the big thing overall is just noticing a whole overall change in either personality or mood. And what I didn't mention as well is somatic complaints or physical complaints is also for children because they may not have the language or the words to express that they're sad or that they're anxious or that they feel tense. So they may complain more about stomach aches or headaches or muscle aches or things like that.
Hmm. Hmm. My final question for both of you is just about further resources. Do you have any recommendations for parents in terms of places where they can reach out for help, either for their children or themselves? And maybe it's sort of on the lighter end, and just sort of like how to get them talking about some of these more challenging topics, or maybe something more significant, like, I know I need help. Where do I turn?
Mhm.
And Nurse Shaw, I'll start with you.
Yeah, absolutely. I think I feel lucky to be a part of Annapolis Pediatrics because we have a great team with our primary care team in office. So you can always reach out to your pediatrician, to your provider overall, and saying, "Hey, this is what's going on. What do you think? Where can you help direct me?" And as we get to know, like you said, that patient or that family a little bit closer too, we may know a little bit how they would respond better to certain means of help in different directions. But I think one of the best places to by our behavioral health department. They have a great section on our website. And we actually have a great list of resources. I was trying to think of some individually, but this is like the best place to go because we have a lot listed right there for different ages overall, too. Addressing anxiety and addressing especially stresses against national traumas or other big stresses and things that have come about, and just anxiety in general. So that may be a good place to go.
Yeah, that's
Mhm.
really
Yeah,
helpful. And we'll make sure that we post that with this video.
great. Great.
Dr. Harris, do you have any recommendations for resources for parents?
Yeah, there are a number of websites and a number of organizations that deal specifically with anxiety in children. You can definitely Google anxiety help in children. A bunch of them will come up. I'll send you a list that you can post with our article here to give you a number of resources that you can look for. They have everything from articles to worksheets to how to talk to your children about anxiety, how to identify anxiety in your children. And then as far as like therapy is concerned, so if you want to get your child in therapy, where do you start? You can always start with the school first to see if they have a school psychologist or a school counselor that your child may be able to work with. If you're looking for outside therapy, there are resources like psychologytoday.com If you go there, you can search for psychologists in your area. And what's good about that is it brings up their biography. So you can see everything that they specialize in and the population that they work with, whether that be children or teens or families. So that's a good resource for looking for a therapist, an individual therapist for your child.
Those are all really helpful suggestions. Well, thank you so much to both Dr. Shandonna Harris, who's a therapist specializing in client-centered therapy, and to Nurse Michelle Schall, a certified pediatric nurse practitioner at Annapolis Pediatrics. Thank you also to all of our viewers and listeners and our sponsor, Annapolis Pediatrics. Make sure that you do visit ChesapeakeFamily.com for local up-to-date information on home, health, and living for today's Maryland parent. This episode will be archived on ChesapeakeFamily.com in both video and podcast format, and we'll also be posting all of those resources that we mentioned. I'm Janet Jefferson with Chesapeake Family Life and Third Floor Views. Thank you so much.
Thank you.